Good Tuesday afternoon. I'm Dr. Martha Buchanan, Director and Health Officer here at the Knox County Health Department. This week is National Health Education Week. Therefore, our moment of gratitude today is dedicated to those increasing national awareness on major public health issues. Health education improves the health status not only of individuals, but of communities, states, and even the nation. It also enhances quality of life and reduces costly premature deaths and disabilities. Health education that is focused on prevention can dramatically reduce the financial costs spent on treatment. We are grateful to those in our community, especially our team here at KCHD, who are committed to providing health education on a variety of public health issues. Our community is truly better for it. Today, we will offer another flu vaccine clinic for the public at the Rec Sports Field Complex on Sutherland Avenue from 2 to 5 p.m. Flu mist and flu shots will be available, but we will not have high-dose flu vaccine at this clinic. Vaccines will be offered to children 6 months and up, as well as families and adults. This clinic is a drive-through. No appointments will be taken. If you haven't received your flu shot yet this season, gather up your family, head over there this afternoon. It's a great time to get your flu vaccine. It's going to be a nice afternoon, I think. Now we'll move on to the local situation. We have 143 new confirmed cases since yesterday's report, giving us 11,857 confirmed cases of COVID-19 in Knox County since March. Additionally, we have 561 probable cases. 10,952 of our cases are considered inactive, giving us 1,371 active cases. 432 individuals have been hospitalized at some point in their illness. Currently, we have 68 Knox County residents hospitalized. Unfortunately, today we have no further deaths to report, keeping our total at 95. You'll notice that our hospital numbers are still high in Knox County. Tomorrow, our benchmarks will display the view of hospitalizations in the region. Keep in mind the numbers that we report today for hospitalizations are only Knox County residents. It's important to remember this number is on top of the COVID patients from other counties and hospitalizations that our hospital systems are currently seeing unrelated to COVID-19. We continue to stress that our community pays close attention to this metric. In seeing the rate of hospitalizations continue to rise, we and the hospital systems are asking the community to intensify your efforts to slow the rate of COVID spread and resulting hospitalizations by practicing the 5 core actions anywhere you go. This is especially important as we enter flu season when hospitalizations tend to increase every year. It is imperative that we follow the 5 core actions, there it is again, and get a flu shot to keep our hospitalizations from being overburdened, or hospitals, from being overburdened. And now I'll open it for questions.
All right, please go ahead and submit your questions into the chat feature. From Daniel with WBIR, we're seeing cases, deaths, hospitalizations start to rise again. Are there any trends there? Are any demographics driving this increase?
No, it's really spread across our community in all age groups. We can look at more in depth at that, but I believe it, off the top of my head, it pretty much is all age groups across the community.
Any other questions? Please go ahead and submit them. Also from Daniel with WBIR, are you concerned about the current hospitalizations numbers? Why or why not?
Absolutely, we're concerned. I believe our highest hospitalizations for Knox County residents has been 70. We're at 68 now. We're concerned about that. We're concerned about the regional hospitalizations, which is why we continue to emphasize and stress to our community. It's very important, several things. One is that you practice the 5 core actions very diligently, regardless of where you are. And that if you have been exposed or if you're sick, that you get tested so that we can put you in isolation. And we know that's really inconvenient, but it protects the rest of the community. And that we can do our contact tracing and have folks be in quarantine so that we slow down the spread. So all of those things have to be done together. It's not 5 core actions or contact tracing and case investigations. They all come together to reduce spread in our community and keep our community safer and ultimately reduce those hospitalizations, which we know are likely to lead to more deaths.
Also, with Daniel from WBIR, at what point would the health department recommend more precautions or actions by the Board of Health to slow the spread of COVID-19?
I think that'll be a good discussion for the Board of Health next week. And we'll continue to look at all those things. It's all of those things together. It's not one piece of data. There's not one thing that we all say, oh, we need to do something. We have to look at all the different pieces of data. Right now, what we're seeing is spread across our community, and that's concerning. And the Board of Health has talked about what would that look like? What would other steps be? And I think what we really need is our community to come together and practice the 5 core actions regularly. We know that wearing masks and social distancing can reduce disease in the community, and it works, and it's safe and easy, and everybody can do it.
From Vincent with the Sentinel, to your knowledge, has any infectious dose for COVID-19 been established for any routes of exposure, inhalation, oral, touch, etc.?
I'm sorry, I missed the question.
To your knowledge, has an infectious dose for COVID-19 been established for any routes of exposure, inhalation, oral, touch, etc.?
Not that I'm aware of. I haven't seen that data about COVID-19. Nope.
From Austin with WATE, what are your thoughts on the proposal discussed last night to create a health and economic well-being advisory committee?
Well, I think it was pretty clear last night when I spoke to the commission about what my thoughts are. It's certainly, I have concerns about duplicating efforts and having too much redundancy in how we're doing things. And so I think we need to come together and make a decision about what we need, what's best for the community, for making decisions around health and economics.
From Megan with WBLT, has KCHD been given any updates about a timeline for when a vaccine may be available in Knox County?
Nope, we know what you know. You know what you're hearing in the media. Maybe November, maybe December, maybe not until the 1st of next year. We'll know we have vaccine when we have it in our hot little hands.
All right, any further questions? Please go ahead and submit them now. From Austin with WATE, new public notice announced that Commissioner Justin Biggs and Dr. Buchanan will meet on Thursday to talk about the direction of the health board. What should we expect?
It's Commissioner Biggs' meeting, and I will be there to listen and learn and participate.
All right, any further questions? Please go ahead and submit them into that chat feature now. All right, I'm not seeing any further questions, so thank you all for your time, and we will see you again on Thursday at 12:30. Have a good rest of your day.